Kyle today. Hi Kyle, thanks for coming in.
Hello.
Appreciate it.
Yep.
L5S1, there's a large right subarticular disc. Subarticular just means that it's extruded, it's a herniation. It displaces and compresses transiting right S1 nerve along the lateral recess. That is why you're having the pain down your legs, numbness in your foot. Mild surrounding enhancing epidural scar, it's old, that's 2018, it's when it first started to degenerate. There's minimal deformation of the thecal sac, which is good. Thecal sac is what's holding on to the nerves without associated canal stenosis. So the canal at the bottom is still large. It's not completely shut off yet, completely pinched. Severe right and moderate left neural foraminal narrowing. So that's where the nerves come out of the spinal cord or spinal column and spinal canal. So the canal is okay, which is good. But it's the place where the nerves come out of the canal. That's where the majority of the narrowing is.
Yeah.
All right, the chronic post-operative changes, status post-right, the hemilaminectomy at L5S1, you had laser surgery done. Good choice at the time, better than any other option that you could have had for sure. And that's all a disc issue, but we have here the L5S1 associated grade 1 retrolisthesis. So the actual vertebra itself is slipped backwards, not just the disc. And that causes severe right and left neural foraminal narrowing. Loss of the lordotic lumbar curvature, so we can work on that. And you do have a inversion table at home, and so
Yes.
that's helpful, right?
Yeah. I use it pretty regularly, multiple times throughout a day. And it does relieve some symptoms. Obviously hasn't corrected the issue, but yeah, it's definitely helpful.
Okay, good.
Yeah.
All right, let me do some exam stuff here. We're going to start off with some posture. So go ahead and lay your arms relaxed by your side. Stand up nice and straight. All right. So we see a little bit of high left ear, high left shoulder. Everyone has this stuff anyway. This just helps me give you a better adjustment. All right, and go ahead and march in place for me, please. All right, so now no valgum or varum there. That's good. Now just stand on your right foot. Okay, left hip comes up nicely. Switch. Good. Okay, so the glute muscles are intact too. No weaknesses there. You can let those go. All right, go ahead and stand up nice and straight and then close your eyes. Okay, you can open your eyes. So very stable, no swaying forward or backward, left or right. So it's a category 3. Let's do this. Go ahead and turn around and face the other way. All right, I'm gonna put my hands on top of your hips here. All right, hips are like almost perfectly even. Just slightly lower on the right. And all of the hypertonicities on this left SI joint, or left glute. Bring your toes together a little bit. Like, yeah, that's good. Yeah, EX on the left. Okay, right or left, which is more tender here? Or same.
About the same, yeah.
Right or left, which is more tender here?
The right. Yeah, the right.
That's right down. All right, let's see, let's turn to the left. Okay, I want you to compare that feeling right there. Turn to the right now. Turn to the right, yeah, good. To that feeling right there. The same, just one side feel more restricted than the other.
About the same.
Okay, let's do this again. Just go to the left. Go a little bit higher up. Clear that feeling there. Go to the right. This feeling here.
Yeah, a little more restrictive when we went that way.
Okay. Do you crack your own back?
Sometimes I'll lay down on my stomach and she'll push on it, like the upper part of my back.
I give him back massages. I don't really put a lot of pressure on it. It just kind of just cracks when I just rub it.
Yeah.
Twisting? Can you lay on your back and twist? And crack it all?
I haven't really tried to crack it that way. Twisting tends to kind of aggravate it a little bit more.
Okay.
I can do it, but
I think I've tried having you do like what I do, and you can't do it.
Usually when I twist, I can actually feel more tightness and pain down my leg.
Okay. Alright, bend forward and touch your toes. Okay, that's good. You can stand back up right there, actually. That's a good movement there. Alright, now the right one. Okay, that's perfect. Actually, come back up. Alright. Alright, let's do this. Go ahead and lift your right leg up in the air. Down. Left. Down. Which side's harder? Or same?
I'd say they're about the same, really.
Okay.
I think the left side maybe is a little bit more difficult.
Alright, I'm going to push down right on top of your sacrum here. Do it again. Right. Down. Left. Down. Did that make it easier or harder?
Maybe a little bit harder. I think lifting the left leg is a little bit more difficult, but I do feel like a little bit of like tightness in here, like pinching almost when I lift my right leg.
Alright, I'm going to bend your knees. Try not to help me. Let me do the work.
Okay.
Good job. Right short, stay short. One more time.
Wow, you can really see that.
Alright, I'm going to palpate the left, the SI joints again here.
Alright.
Alright, ready? We're going to compare this. You have any tenderness in here?
Not really.
That's all good?
Yeah.
I'm push into it a little bit more. That's okay.
Yeah, it's a little very tiny bit of tenderness, but nothing like bad whatsoever.
How's this one feel over here?
Yeah, same. A little tender there.
Yeah, this is the one. Okay, this is where your tender seated to. All right.
Ooh. Yeah.
All right, I'm just going to work this trigger point out.
Yep.
Before we go further. All right, let's give this a try. Go and take a deep breath in and out. Again, breathe.
Ooh.
Good job. We're just gonna try to like decrease some of the tension, unwrap some layers
Yeah.
before I get in there and try to make a good adjustment.
Alright.
And do the decompression too. The inversion table is good. The decompression that I do, it's like hanging on your inversion table for 100 hours straight,
Oh my gosh.
all in 1 second.
Awesome.
Do you get a couple sessions on the inversion table a day?
Yeah, usually twice a day for at least a few minutes.
Okay.
Sometimes what I'll do is I'll pull him while he's on it.
Oh, that's perfect.
Yeah.
Yes. That's awesome. You do it by the head or what?
No, I'll just pull, I'll just
So-
drag my hands down his back.
Yeah, so I should mention that usually when I use it, I actually kind of use it differently than most people. I don't lay on my back, I lay on my stomach. And I don't...
Does it feel better that way?
It does.
Did you try it the other way?
I do. I kind of mix it up. I do it both ways.
Okay.
I feel like when I do it on my stomach, it kind of it pulls that things just in a little bit better way. Like it kind of helps my pelvis kind of come back a little bit. Sometimes I put a pillow under my pelvis and kind of just like it helps kind of like I feel like push the pelvis back and pull the spine down.
Okay.
But I do occasionally go the other way as well, which the other way actually helps more with the pain that I get in the front. Like right there on the front right of the hip.
Yeah, it's the front right.
Yeah.
That's fine. That's actually just your psoas muscle.
That's what I thought.
He's been saying that.
Yeah. That's what I've been, I've been trying to stretch it and everything. And stretching does help it, but it's still just,
Pretty
it
sure.
tightens right back up.
Like, is it like you feel it in here?
Yeah, it's usually in there, and then like it kind of it goes right up into
Yeah.
like right into my stomach a little bit.
Well, that's the thing about the psoas muscle. You've probably seen it, but it attaches from the front of your femur
Yeah.
up here,
Yep.
and then it goes up your pelvis through the cavity and attaches to your
To the
spine.
spine. Yep.
Really?
Yeah.
Oh, okay.
Interesting muscle.
So it's all coming back to that spine issue.
Absolutely.
Yeah.
The good thing is that you have a retrolisthesis, And so the retrolisthesis means that the slippage has gone backwards. Okay, so it's
Yeah.
okay to push in this direction. We just have to be very specific.
Yeah.
But some people have an anterior listhesis where it goes forward, and then it's much tougher.
Oof. Yeah.
So it's okay that I'm pushing on his back.
Yeah, I wouldn't push down here though.
Okay.
Like I wouldn't push right where the scar is.
No, we usually actually he's been up and to the right a little bit in there.
Yeah.
Yeah. Almost like kind of going into his hip, almost on the side. That's where he's
Yeah.
been having me massage a lot recently.
Yeah.
Okay, good.
But years ago, it was definitely by the incision.
Yeah.
Yeah.
That's okay. All right, I'm gonna do some cracking here. Okay. It's actually pretty good here. We've got just right at 6, which is L4. 9, 5, 8, 4. So we're gonna start with T8 in the middle. We'll get everything above it and below too, but it's really T8 and L4 are the most important. T8, L4, this S4 on the SI joint. Then I'll look at your neck and do a decompression.
Okay.
All right, let's start with this one. Let's practice one first. I'm going to follow your breath so as you're breathing out. Good. We're just going to go like this. A little push like that, okay? All right, let's give this one a try. Go and take a deep breath in and out. Good. See? Here. Good. Not bad. A little release there. Good, Kyle. One more on this guy. It's not done yet. Good. All right, I'm going to adjust this one here. So I'm going to push on the in-breath there. So right as you're starting to breathe in, that's when I'll push. Go let that out. Good. One more time, same breath in. All right, let's give this guy a push here. Deep breath in here. And out. Right, left, right, left. Is one of these more tender?
Yeah, they're right.
All right, we're gonna bend this top leg here like this. Bottom leg is straight. All right, I know that twisting usually aggravates things, okay? So I'm not gonna twist anything. Okay, right now your spine is completely neutral right here. Okay, I'm gonna adjust this lower SI joint. We're gonna really make sure that we're not twisting any lumbar structures. Okay, any aggravation or anything when I push right there like that?
No.
All right, let's go with this. Okay, deep breath. Good, and out. Good, one more time. It's right there. Oh. Okay, lay on your back.
Yeah.
Is this here the whole time?
That's a birthmark.
Okay.
Yeah, sorry. Should have mentioned that.
Everybody that sees that is
Yeah, I always
"What is
forget.
that?"
I always forget to mention it.
No, I should have looked at it. I'm sure it was. I just didn't see it.
Yeah, no, you're good.
Any increase in pain or discomfort in your hip, leg, foot?
No, if anything, feels a little bit better.
Okay, good. Reversed. That's interesting. Okay, let's do this. Go ahead and turn your head to the right. Back to center. Left. Good, center. All right, let's do this one now. Go ahead and bring your right ear down to your shoulder.
My right ear down to my shoulder.
Yep. Good, back to center. That's good. All right, okay. Okay, I'm going to adjust here. Cervical spine now. We're going to do the right side first. All right, neck is actually pretty straightforward, simple listing here. We're going to give it a nice gentle push on the atlas right there. Over there. Nice and gentle breathing. You're nice and relaxed right now, Kyle. We'll just give this a little push here and open this up. Good. Hold on, it's right there. One more time. Let the shoulders go. Not bad. That was a little bit more locked up than I thought. Let's see what the left side says. 7, 6, 5, 4, 3, 2, 3 here. Good. Letting everything sink in here. Ooh. Good, that was good. Ooh. I'll check out this one again here. Can you crack your own neck? Is that why? It's not too bad.
I used to. I haven't done that in a very long time just because I've heard of the dangers that can happen with that. So sometimes it does. If I just stretch it like to the left or right a little bit, it might give a little bit of a pop.
Okay.
Yeah.
All right, we're gonna do this one on the right again then. All right, this time a little bit different. I'm gonna go right from here. I'm gonna turn in this direction like that. Mm-hmm. Good, you're doing good. You can close your eyes. Nothing to look at out here. Just give it a little breath. We'll follow the next breath. Good.
Dang.
All right, let the head relax here. Let's check this occiput out. All right, bend both your knees so your feet are flat. Mm-hmm. Good, and then squeeze my fist here in between your. Good, sweet. Good.
Jeez.
Is that your bag?
That was something in here. Yeah.
It's tender on this side.
On the left side, actually, a little bit. Well, there it is. Yeah.
Yeah,
right
both sides equal.
Yeah.
Is it tender there?
Not really.
Not too bad. Yeah, that's good. Right, let's do this. Good. Painful?
No.
Up your head. Good and down. Arms here. This little pull, make sure your hips are tight. All right, nice and gentle breathing. I'm gonna use this towel. You're okay with that? Mm-hmm. All right, we're gonna follow the breath as you breathe out. We're gonna go in this direction like that, and then give a pull like this. So let's give it a try here. We'll follow the next breath. Go take a deep breath in. Good, and out. Oh! Oh! Breathe.
Oof. Are you okay?
Yeah. Oh.
Breathe, yeah.
Ooh. Oh.
That's pretty big.
Yeah. Wow. Yeah, I've never felt anything like that before. Jeez. Whew.
That's pretty much as hard as I could do it, too.
Oh, I appreciate
I was
it.
topping out there at like 99%.
Oh. Wow.
All right, let's do this. Roll to this side over here.
Yep.
And now swing your legs off and stand up.
Yep. Oh.
Good, and then stand up. Good, pull laps. Walk around a little bit.
Yeah. I don't feel anything in the leg.
Wow.
Yeah.
Actually, that's good. That's what we want.
Yeah.
Almost, if you had more back pain like coming up after this, that's a good thing.
Yeah, it's not as painful as it was for sure.
Yeah.
It feels different. Yeah. It feels good.
Good.
Yeah.
All right, stand right there, face that way.
Yep.
Good. Squeeze your shoulder blades back together. Yep. Good. Just like that. Look up at the ceiling. Good. Head up. Shoulders relaxed. Okay, that's really nice. Yeah. So when the pressure on the nerve is so deep that it goes down the leg, that means it's gone past the point of pain in your back.
Yeah.
So like when a disc first presses on it, the first thing it does is hurt in your back. And then the deeper that pressure gets, the further down it goes. So as you unwind that pressure, you'll start to, if the leg stuff goes away, which is the first goal, your back may start to hurt. Mm-hmm. And then after that, it continues to release.
Okay.
Well, I'm going to check the tailbone here. Okay, do you have any discomfort or tenderness here?
No.
Any discomfort or tenderness here?
No.
Push. Push, push. Good. Right side here. Push. Let's go. Nice. Now relax. Here, turn your face out the window. Take it like a little half step back here. We're gonna hold up like this, like this. Good. This one over here. Good. Relax. Good. Good. All right. It's hot up here. All right, so yoga I think is important, the key. And if there's one thing I would add to your supplements, you had mentioned ashwagandha before. It's a great stress reliever. It's probably one of the best stress adaptogens that there is. All right, so the usual disc protocol, I like to increase magnesium and turmeric. I'll write down some brand names and stuff for you.
We've been increasing our turmeric recently.
How much you taking?
Not enough.
Yeah.
You could
We just put it in everything we eat. Whenever I cook, I put
okay.
turmeric in it. Yep.
Do you take pills or just eat it?
Just eat it.
Any questions or anything?
You're all-
guys.
Yeah, you
Thank
too.
you.
That's
You've been
it.
wonderful.
Yeah, absolutely.
Yeah,
Absolutely.